Hey, welcome. In medicine, some of the most important work, it's completely invisible. So today, we're going to pull back the curtain on these really complex, unseen systems that keep patients safe during what are, frankly, some of the most high-stakes treatments you can even imagine.
So, that really brings us to the big question, right? How do you guarantee safety when the stakes are literally life and death? This is the fundamental question that drives this need for these incredibly detailed, super robust quality systems. All right, let's really get into it. Okay, so let's set the scene here. We're talking about the world of cellular therapy and stem cell transplantation. And this is a field where, historically, the stakes were just unbelievably high. I'm talking significant risks to a patient's survival. So when you're dealing with procedures this complex, often across international borders, the need for airtight quality control, well, it's not just important, it's everything.
So to meet that huge challenge, these standards called FACT-JACIE were developed. And you can really think of them as a kind of universal language for safety. They were created to fill a really critical gap, basically to make sure that no matter where a patient or donor was in the world, the quality of their care would meet the same, consistently high standard.
All right, so if you're going to build a system for safety, you absolutely need a plan, right? A blueprint. So let's take a look at the blueprint that actually structures this entire process. At the very heart of this whole thing is something called a quality management system, or QMS for short. Now, this is not just some dusty binder sitting on a shelf, okay? It's a living, breathing, documented framework that outlines every single process, every procedure, and every responsibility. You can think of it as the master plan for making sure everything is done right.
And here's where things get, well, really complicated and pretty interesting. See, hospitals aren't just dealing with one set of rules. No way. They have multiple standards they have to follow, like JCI for the hospital in general, ISO for the lab, and then JACIE specifically for transplantation. And a lot of them overlap. This creates this enormous pressure to build one single, unified system that doesn't just duplicate a ton of work.
Which leads us to this quote, and it absolutely nails the challenge. The author points out that weaving all these different standards together, making them all work in harmony without creating some bureaucratic nightmare, that's not just a science, it becomes an art form. It really takes skill, creativity, and a super deep understanding of how the work actually gets done. But, a blueprint is totally useless without the builders, right? And the art is nothing without the artists. The most crucial part of any quality system isn't the stack of documents or the rule books, it's the people. So let's talk about how you build that team. And this is such a critical point. You don't start with the rulebook, you start with your team. Think about it. These standards were created in the first place by professionals in the field. So the real foundation is the collective knowledge and experience of the staff you already have. The QMS is just there to help organize all that expertise, not to replace it. And this really gets to the core philosophy here. Quality is not one person's job. It's not the quality manager's problem. It has to be a shared culture. The policy is that everyone is responsible for the QMS. Everyone gets tasks assigned to them, big or small, right alongside their normal duties. That way, the system becomes part of the daily workflow, not just some extra burden piled on top.
So how do you actually make that happen in practice? Well, you make it manageable. Super simple stuff, really. Instead of one person getting stuck updating 20 documents, you give a few people a couple each. You get the secretary involved in checking transplant data. Why? Because they're the ones looking at it every single day. And you team up experienced folks with newer colleagues. It's brilliant. You're building knowledge and making sure it gets passed on.
Okay, so we've got our artists, the team. Now let's look at the tools of the trade, the actual instruments they use to create this masterpiece of patient safety.
The main tool in the toolbox is the quality manual. Now, don't picture some massive book with every single procedure written out. It's not that. It's more of a high-level guide. It lays out the who, what, and why of the program. And what's really critical is that it shows the organizational chart, the communication flow, and confirms that the clinical program director has the final say, the ultimate oversight, even if they're not involved in every tiny detail.
Audits are another huge tool, but probably not in the way you're thinking. The word audit can sound a little scary, right? But here, it's not about pointing fingers or getting people in trouble. It's all about learning and getting better. And they get super specific. You're not just auditing the lab. No, you're diving deep into the nitty-gritty, like the exact process for determining if a donor is eligible or how chemo drugs are verified. These are mission-critical checks to make sure the system works perfectly every single time.
And of course, there are a few other essential tools in the kit. You've got your standard operating procedures, SOPs, which are basically the detailed step-by-step instructions for how to do things. Then there's change control, which is just a formal way to make sure any new changes are rolled out carefully. And finally, process validation. That's how you prove, with data, that a process actually works and gives you the right result time and time again.
So you have all these different pieces, right? The blueprint, the team, the tools, and they all come together for one single, incredibly powerful purpose. This is the whole point. This is why all of this matters so much.
And this slide just lays out the keys to success perfectly. It's like the golden rules. Number 1, start with the knowledge your people already have. Make everyone feel like an owner of the system. Use your audits as a chance to learn together, not to place blame. And hey, don't reinvent the wheel. Check what's already in place before you add something new. And finally, talk to people. Ask for input from experienced colleagues in other hospitals. It's all about collaboration.
And that really brings us back to the most important point of all, the art of maintaining a quality management system. It isn't about passing an inspection or just ticking off boxes on a checklist. All of this incredibly detailed, collaborative, and yes, creative work is all for one thing, to produce one final invaluable masterpiece, and that is the safety and the well-being of the patient.
So, as we wrap this up, it kind of leaves us with a final thought, doesn't it? When you think about it, whether it's medicine or flying in a plane or even the food you eat, what are the invisible systems, that unseen art, that are working behind the scenes right now to ensure quality and safety in your world?